Waheguru Ji Ka Khalsa, Waheguru Ji Ki Fateh. Today is the 20th of January 2021. My name is Dr. Sukhdev Singh. I am a Birmingham GP for the past 32 years. My GMC number is 2940935 and I qualified in 1984 should anyone want to check my authenticity. Prior to the rest of the video, I'd like to wish everyone a happy Gurpurab on the birth anniversary of Sri Guru Gobind Singh Ji today, our 10th Master. So coming back to COVID, this should really be a 1-minute video saying take the COVID vaccine, it's the right thing for you, it's our first opportunity to get the pandemic out of the way and then to focus on rebuilding our new normality with our time and energy. I wish life was that easy, but there are increasing number of people in a dilemma of whether they should take a vaccine or not. And that's why I want to spend a few minutes going through this in some detail to give you the compelling case for vaccine. And this is not me just saying I think you should make an informed choice. This goes beyond informed choice. It goes to the point of I think the only right thing to do is to take a vaccine, and I encourage you very strongly to do that. If this is merely about you and your health, then perhaps you could take a choice of saying, I don't think I'll have the COVID vaccine. I don't mind having COVID-19. I don't mind dying. I don't mind an avoidable death. And that's obviously just thinking about yourself. But COVID isn't just about you. It's about how you impact on all those people around you, all the other people that you can spread the illness to, and all those that you could potentially kill. And if you believe in Sarbat Bala, you will want to be concerned for the health and well-being of others, and you'll want to actively help others. And the one single most important thing you can do to actively help others is to stop them from dying an avoidable death by taking the COVID vaccine. And if that's the only message you want to hear today, please switch off the video and just do that. If you want it for yourself, to protect yourself from COVID-19 illness and the other benefits, please listen on. I'll tell you my story first. I took my vaccine last Thursday, the first vaccine. I took the AstraZeneca vaccine after my GP called me. And we'll come back to the role of the GP in a few minutes. I had the vaccine, it didn't really hurt, pretty okay, felt fine that day. Second day after the vaccine, I felt surprisingly well. I almost thought I hadn't had the vaccine. But that's no surprise because only 1 in 10 will suffer some common minor side effects, like sore arm, a bit of a fever, a bit of a headache, a bit of muscle ache. But I fell in the 9 in 10 majority where you have no side effects at all. And I was very pleased with that. And I hope the same happens with my second vaccine, which I can't wait for. The first vaccine, by about day 10, will confer you about 50% protection. The vaccine essentially primes your immune system to get ready for battle from a potential COVID infection. It has its antibodies and T cells and other parts of the immunity ready. And as soon as you get attacked by a COVID virus, before it can multiply and take over your body, it kills the virus. And it does that very effectively, just like all the other vaccines you've had in your life. The second COVID vaccine will give you the second jump up to 95% protection. So the 2 COVID vaccines collectively give you 95% protection. And the second vaccine is normally after 3 or 4 weeks. But you will have heard in the NHS that's been extending to 10 or 12 weeks. And that's entirely reasonable considering today's situation. It is better to have the whole population covered with 1 vaccine at 50% protection than just a small number who take the 2 vaccines. So that is the benefit of the injection. It stops you getting COVID-19 disease. But there has been recent research showing after having been used 5 million times plus in this country and in other countries like Israel, which is far ahead in its vaccination program, they have noticed that a second huge benefit is happening, which is having the vaccine reduces your ability to transmit the virus to somebody else. So you become less of a contagion. Because as you know, 1 in 3 people with COVID do not know they have it, and they walk around asymptomatically without any symptoms, but they're infecting anyone and everyone who comes into contact with them. Every contact is potentially a chance to get COVID infection. So we should be reducing every contact, every unnecessary contact, until we get vaccinated. So the reduction in transmissibility is really welcome because it will speed up the rate at which the pandemic ends. Everybody who is on the eligible list for a vaccine should get the vaccine. And the current plan is by January 31st, all care homes to have been vaccinated. By middle of February, all those in the top 4 category areas, in other words, 70 and above, 80 and above, all NHS, all care homes, that's 15 million, should have been vaccinated by 15th of February. That is vital because that is actually 80% of the current folk who are hospitalised. And at the moment, there's a hospital admission every 30 seconds due to COVID. The number of people in hospitals is the same as 30 hospitals full of COVID alone. No wonder the NHS is virtually collapsing, because it has to deal with all the other pressures it normally does, and winter, as well as this huge COVID burden. So the third duty for the vaccine is to save the NHS. So number 1 is for yourself, and if you don't care about yourself, at least care about others. Take the vaccine for others if you care about others. And if you don't care about others, try and save the NHS. But I don't think people are that careless. They really want to care for themselves. They want to care about others, and they want to care for the NHS. And they also want to care for the economy, because we've got to get past the pandemic and get all of our time, energy and efforts to build a new normality and get back to the lives that we need to be living. So please carry on trusting your GP, who you have entrusted your life with since you were born. Your GP gives you a cradle to grave service. In your first year of life, you'll have had 12 vaccinations, which you probably cannot recall. You've had diphtheria, tetanus, whooping cough and polio. You had 4-in-1 vaccine given 3 times. You then had measles, mumps, rubella at the age of 1, 5 and 15. You'll have also had a tetanus booster at 15 just before leaving school. Many of you will have had a tetanus booster after 15 every 10 years. Many of you will have had vaccines to go abroad to save you from tropical diseases. Now, most of these vaccines are not as effective as the influenza vaccine, which many patients have every year. And influenza vaccines are 60% effective. But the COVID vaccine is like influenza, as safe as influenza, but much more effective because it's conferring over 90-95% protection. So really, it's a no-brainer to have the COVID vaccine. Why would you not want to listen to the real evidence and your GP who's acting in your best interest as your best advocate? Murray polls on opinions, like Ipsos, are done every year. And the public are asked by Murray every year, who do you rate as the most trusted professional in society? And year after year, I'm glad to say it's your GP, who gains 93 to 95% of the votes every year. And that obviously is the reason why the public trust their GP to that extent. And I want you to extend that trust to this COVID vaccine. Remember, it is your GP that will give you the invitation to attend. They run the vaccination program. They are the primary source in the NHS to be fighting this COVID vaccination campaign. So if you get a letter, go to your GP, get your vaccine. My last point is going to be about informed choice. Some people are saying, well, just tell us the pros and cons and we'll decide if it's for us or not. I'm sorry to say that is not the approach you should take in a pandemic to COVID-19. Taking the vaccine is not just necessary, it's an absolute must. I've already told you for why. For the selfish reason for yourself, for others, for the NHS, for the economy, and to get the country back on track. And just as GPs in other similar situations will be very forceful with their advice, such as smokers telling them to stop smoking, you do not want lung cancer, you do not want to give yourself a death sentence. 2, obesity, do not overeat, your obesity is harming you, you're going to become a diabetic, your blood pressure is already up. GPs are very forceful in certain areas of health, and COVID-19 is one of those. And that's why we're not just simply saying, sitting back, here's the evidence, take it or leave it, it's your choice. This is beyond informed choice. And I hope you understand that. So I will end my video here and first of all make an apology. If I have hurt anyone's feelings, I don't intend to do that. This is with my best intentions to help you have that decision of taking the vaccine. I am forceful in my approach on this because that is what is needed in this current arena where we have 2 pandemics. The pandemic of the COVID virus and the bigger pandemic of the misinformation. And the misinformation is almost beating the real information. The latest survey on take-up of the vaccine is really disheartening, and that's why I've been compelled to make this video. For South Asians, take-up of vaccine, 57 out of 100 eligible are taking up the vaccine, 43% are not. That is really not the right way to manage this. You are doing yourself an injustice. Misinformation is creating more deaths at best. Do not deny honest citizens the real information, because if you confuse them and they decide not to take up the vaccine, they are effectively asking for an infection and potential death. And we do not want avoidable death of grandparents, parents, brothers or sisters or children, friends or family or other citizens in the country. So please take the vaccine, on my humble request. Waheguru Ji Ka Khalsa, Waheguru Ji Ki Fateh.